Imagine a newborn taking its first breath and a toddler laughing, only for both lives to vanish within days because of where they were born, a choice they didn't make. Between 1990 to 2023, neonatal deaths have reduced from 5.2 million to 2.3 million, and under 5 deaths from 12.8 million to 4.8 million. This shows progress, but the pace of reduction is slow. A child in Sub-Saharan Africa is 18 times more likely to die in the first month of birth than in high-income countries. This is why SDG 3.2 matters now more than ever. Economic inequalities, political instability from inconsistent governance in Sub-Saharan Africa, and social barriers like armed conflict which dismantle health systems and displace families are the main wicked problems impeding SDG 3.2 progress. These factors have negative impacts on a local, national, and global level. For instance, in Accra, the capital city of my country, Ghana, urban slums face overcrowded hospitals. Also, rural areas in Ghana lack sufficient skilled healthcare workers, which leads to poor care for children. And on a global scale, Sub-Saharan Africa and South Asia bear the heaviest burden. Do you know globally, economic crisis and shrinking health investments are impeding SDG 3.2 progress? Because most affected countries have slowed economic growth and rising debt burdens, which forces many governments to halt health budgets. This weakens programs for maternal and neonatal care and childhood immunizations. As a result, preventable deaths from pneumonia, diarrhea, malaria, and birth complications remain high. According to UNICEF, the rate of child deaths between 2000 to 2015 was 3.7% per year, but it fell to 2.2% per year between 2015 to 2023. This slowdown is attributed mainly to neonatal deaths, which are hard to prevent due to birth complications, infections, and conflicts. The two main SDG 3.2 2030 goals aim to reduce neonatal mortality to 12 per thousand, which is currently 17 per thousand live births, and under 5 mortality to 25 per thousand, which is currently 36 per thousand live births. Every Newborn Action Plan, known as ENAP, is a global initiative launched in 2014 to contribute to these two main goals. It is a multi-stakeholder partnership led by WHO, UNICEF and partners, uniting governments, NGOs, and health institutions to reduce neonatal mortality and stillbirths. They focus on scaling up quality care during pregnancy, childbirth, and the post-natal period, including skilled birth attendants and care for small and sick newborns. ENAP is supported by multilateral donors, philanthropic foundations, and national governments, often through WHO, UNICEF, and allied global health financing mechanisms. Since inception in 2014, ENAP has helped 39 countries, including India, Bangladesh, Ghana, Nigeria, Kenya, and many others, adopt national acceleration plans. ENAP has been part of this global impact. That is, reduce neonatal deaths from 5.2 million to 2.3 million, and under 5 deaths from 12.8 million to 4.8 million since 1990 to 2023. This initiative is challenged with gaps like insufficient funding and weak health systems since 2015. Hence, it calls for global collaboration, data-driven targets, and country reforms. This teaches us that without sustained funding and actions, progress stands still. This is why ENAP must continue with renewed urgency and resources to save every affected child. SDG 3.2 aims to reduce neonatal deaths to 12 per thousand and under 5 deaths to 25 per thousand live births by 2030. In 33 years, neonatal and under 5 deaths have reduced by 38.5% and 62.5% respectively, which most part came from the SDG 3 launch in 2015, an initiative like ENAP. ENAP is still challenged with less funding, and it also looks unrealistic for dozens of affected countries to meet the 2030 target. This frustrates me because millions of children will continue to die while waiting for justice. Children are dying. Families are mourning. Will we act before 2030?